Joining me now is Dr. Stephen Weinstock. He is the founder of the Eye Institute of West Florida. Thank you so much for joining us today.
It's my pleasure, Randy. Thanks for having me.
So we're going to talk about things that bother people. I know it bothers me anyway. Eyeballs. Eyeballs are something that you do all sorts of things to. Some things good, some things bad as a surgeon. But they're these instruments that we have that let us see a lot, but also as doctors it lets us see a lot into the eye itself. And this is kind of Eye Health Awareness Month. We're looking at things to make people think about these important objects in our face that work so hard for us. And when we look at this, there's a lot of things we take for granted. One of the few things that most people do is get eye exams. They just don't think they're that important. And if they see fine, they wear glasses or whatever else, they think, oh, it's not a necessary thing. But we really know a little bit more about that as far as what we can get from an eye exam. So let's go backwards a little bit and talk about eyes and eye health themselves. Obviously, eyes help us see, but tell us what we're looking at when we have an eye and how it works for us. That gives us all those little details.
Well, you're right. I mean, when we look at an eye, the beauty of it is we don't have to get x-rays and guess what's there, or MRIs or CAT scans. We can pretty much see what's there and prevent so much of what we see could happen to an eye. So eye exams for the population in general are crucial to prevent blindness and other issues with eyes. So we're really lucky to be in ophthalmology and be able to see what we can see, no pun intended.
No, every pun intended. This is what we do here. So if you think about the eyes as the windows of the soul, actually as a doctor, the eyes are the kind of the window to the body's disease process and health. So typical eye exam, we look at a little chart, says we can see or not. But the idea behind it is so much more. So tell us what you're looking at when we're looking in the eyes and how those things change with different processes.
Sure. Aside from just the eyes themselves, which we're trying to evaluate somebody if they have any problems visually, okay, we can also tell a lot about a person's health. We can tell if a person has diabetes very often, high blood pressure very often, other diseases of all types, because we can see blood vessels inside the eye, the retina, the blood supply, and that gives us all indications of what's going on with your general health. And we can make recommendations, therefore, to what you should be doing. Okay, so if we see exudates, for example, in the retina, exudates are just little leaky blood vessels that produce these little deposits. We know you need to get to your internist rapidly, take care of your high blood pressure or your diabetes, get tested, make sure that you're healthy. So general nutrition, general health for the eyes, general body nutrition, that all is interplayed. It all comes into effect, and it's very critical. When we do an eye exam, we know a lot about the body itself.
Which is an impressive piece. A lot of people mistake the thought pattern that they're just there to get glasses, to see better.
That's why they come in, right? I mean,
if you can't see, obviously you're going to come in and see the eye doctor, but you
those
get so
aren't the
much
patients
more.
I'm worried about.
Right.
Because I know they're coming in. It's the ones who can see well that should be coming in for checkups, because they may have other things that are wrong that they don't know about, and in their eyes as well as their general health.
So let's talk about things and times to get these eye exams. I mean, an annual exam obviously means annually, so we would like to see that. Majority of people don't think too much about that. But children exams, I mean, when we look at the kids, they don't have the ability to tell us what's wrong. So those exams will give us a lot of insight into it. But you had some interesting thoughts about kids, how to prevent certain things going in the future. Talk about that for a second.
Absolutely. In development of vision, it's critical that you have good ability to have a focused image on your retina in order to develop the pathways into our brain, those connections, so that we can see well. So as an example, if someone's born with an eye turned in and they never use that eye, by the time they're 7 or 8, if we found that out, it's too late. Those pathways won't develop. However, if we catch that earlier, we can patch the good eye, make them use the bad eye, and those pathways will develop. If it doesn't, that's called amblyopia. And you can't correct amblyopia. So unfortunately, in my years of practice, I've seen so many patients who've been blind in one eye for their whole life, and they still come in and say, is there anything new that can fix that? And I say, I'm so sorry, that's brain surgery. It's not eye surgery, and we don't have the answer for that yet. So having a screening prior to age 5, when those neural pathways form, is critical. So we do, as the Eye Institute does, we do a lot of screening at schools so that the kids in kindergarten and pre-K specifically get checked.
Sure, and we know that there's a lot of attention issues. If you can't see, you don't pay attention, so a lot of the things that the kids have as bad habits, not their fault, but it starts at that time when they can't see or can't hear the right things. So as we go into adolescence and to adulthood, eyes change, obviously,
Right.
and we're looking for different things. One of the things you talked about earlier is the leading cause of blindness, which I really thought was going to be glaucoma, but...
Well, glaucoma is the sneaky kind of blindness. Cataracts cause blindness because people just don't take care of them. They say, well, I can still see. And when I talk about blindness, I'm talking legal blindness.
Sure.
Okay, that means less than 2200 vision. So I have people coming in all the time that shouldn't be on the road. That's very dangerous, but they think they can see fine. And cataracts are the leading cause of blindness. And today, technologically, they're so easy to take care of. And the results are so fantastic. So it's very important to take care of them earlier rather than later. That's really critical.
And
it's so easy.
The world changes so much when you can
Oh my
see
God.
clearly. On the days that you can't see, you're not as happy, you're irritated and other things. So when we talk about this annual visit, and obviously for prevention, that's obviously making sure we do it ahead of time. Just give us a quick rundown of what you expect in that annual visit so that people can go out and get them annually.
Sure. I mean, I think that every annual visit basically is a complete eye exam. So we check the vision, and make sure it's okay, and I'm just a detective. If that vision isn't 20/20, I need to know why, and I'll be able to see why in the exam. So we check the vision. Then we see if it can be improved with glasses. If it's improved with glasses, I've got my answer. If it's not, I have to go deeper and say, well, there's something wrong. Okay, now what's wrong? Well, I can see. Is your cornea, as I'm looking at you, is it clear? Yeah, your cornea, your front surface is clear, so there's no issues there that I can see, but we have technology that actually maps the cornea. And maybe there's some irregularities in the shape of the cornea, like astigmatism, and we can't see it just by looking. So we have to do this other test sometimes, if you're not 20/20. I can look beyond it at your pupil and behind your pupil, and I can see if there's a cataract there. But I can also see the depth between the cornea and the cataract. And if that depth is shallow, we're prone to an acute glaucoma attack. And we have an instrument we can place on the eye to determine what that likelihood is. And if there's a likelihood of that, there's a simple laser procedure to prevent it. Because if you have acute glaucoma, one attack of pain in the middle of the night, a few hours later you're blind. So that's not a good thing, and we can tell that just by looking. We tell if there's a cataract. Okay, we check the pressure in the eye. Because there's two kinds of glaucoma, the acute kind and then that sneaky kind that sneaks up on you because the pressure keeps going up, and as it goes up, it starts to destroy the nerve fibers in the back of the eye, and as those nerve fibers die, you can't tell it till the last ones die. So you lose all your peripheral vision. Before you know it, you're starting to lose central vision, and now it's basically too late. So that really sneaks up on you. So having a pressure check in your annual exam, critical, okay? So we want to know what that is, and then we kind of correlate it with what does the nerve look like to make sure that even though the pressure might be high normal, the eye's still tolerating it. Then we can also look at the retina. We look at the retinal blood vessels. We can tell whether there's any kind of generalized disease, okay, that's affecting your blood vessels, not only in your eye, your heart, okay, your neck, for strokes, okay, your kidneys, everywhere, diabetes. We can look at the nerve, and we can see, okay, is your nerve healthy? Or what is your risk of having glaucoma by looking at your nerve? Because you have a large, what we call a cup. So, okay, so there's so much we can tell by looking.
Lots we can do, obviously. And we could talk about this for a long time. I'm sorry that we can't, but the eye exam is extremely important. Health Awareness Month for eye exams, making sure that you go and see that annual visit, see your ophthalmologist, make sure your eye health is the rest of the health of your body, and make sure that you can see for the rest of your life. Last thing, of course, and I got to throw it in there, sunglasses, sunscreen, sunglasses, very important in the state of Florida. So I know we've talked about it. It's extremely important to have. Wear them and be healthy.
Absolutely. just like you put on sunscreen, you better put on sunglasses
Yeah.
because that causes cataract.
Yeah, thank you so much for joining us today. Great information, stuff that we all have, stuff that we all ignore. But this is the month to make sure that people are at least aware of it, but it's an annual visit and make sure it happens.
Well, thanks for having me, Randy. Appreciate it very much. I hope that people do too.